Hi, my name is Kelly Barringer. I'm one of the senior staff physicians at Regions Hospital. Today we're going to be talking about hip dislocations. So first, let's start with a few basics about anatomy and hip dislocation in general. So it takes a lot of trauma in order to cause a hip dislocation. The majority of these injuries that we're going to see are from motor vehicle accidents. They typically happen when the dashboard strikes the knees and forces the femur posteriorly relative to the pelvis. However, you can also see these hip dislocations in other high mechanism traumas, such as jumpers or people who fall from heights. We're going to talk only about posterior hip dislocations today because almost all of the hip dislocations that you're going to see in your practice, over 90%, are posterior. Because of the vascular supply to the hip, patients with hip dislocations are at high risk for avascular necrosis, which can lead to dysfunction and chronic pain. These are true orthopedic emergencies. The longer it takes to put the hip back in place, the higher the risk of AVN. So our job is to recognize this and get the hip relocated as soon as possible. Here is a picture of the typical presentation, what you'll see when the patient comes into the ER. If you'll note that the hip is internally rotated and shortened. A couple things to remember before starting. Like we talked about before, the hip is a stable joint and held in place by very strong muscles, so you need to get the patient relaxed. Procedural sedation is almost always a must. You also need good counter traction to keep the pelvis on the bed. So you can either tie the pelvis to the gurney with a sheet or have someone hold the pelvis steady while pushing the pelvis down onto the bed while you work on reducing the joint. Now that we know we have a hip dislocation and we're ready to try to put it back in, let's talk about some different reduction methods that we can use.
The first technique that we're going to talk about is the Alice technique. This is the technique that you probably see the most often when we're trying to reduce the hip. There are a couple of big problems with the Alice technique. First of all, it's kind of hard to do. You have to get up on the bed, try to get the patient's leg over your arm or over your shoulder, and then use your back and the leverage from your arms to get that hip back into the socket. The big problems with this, first of all, is that it's hard to do. You can hurt yourself. I've seen gurneys flip over, and it puts the patient at higher risk too if you manage to flip the gurney over during the process. The next technique we're going to talk about is the Captain Morgan technique, named for a picture you might see on your favorite bottle of rum. Here we have some members from the emergency department demonstrating their best Captain Morgan pose. It's helpful to remember this pose because this is the stance you'll use when trying to reduce a hip using the Captain Morgan technique. Now we're going to have a couple of our fine ER residents show you how to do the Captain Morgan. First of all, get the gurney low, and then you might even need to use a CPR step stool to get your knee up to the proper height. The lift comes from both your stationary leg and then also from the calf of the leg that's up on the bed. You can also add internal and external rotation as needed. If you're having trouble, you might also consider using pirate sayings or speaking in a pirate voice. Next, we're going to talk about the over-under technique or the Whistler technique. Positioning is key. So you want the foot of the good leg tucked up under the butt as far as you can in order to get that knee up as high as you can. Next, you want your arm under and then over to rest on top of the patient's good leg, which is up as high as you possibly can get it. Once you've got your arms in good position with the good knee up as high as you can, you want to turn your back to the patient. This puts you in the proper position with your back perpendicular patient to lift up with your legs and put upward traction on that hip. You can then use your free arm to do internal and external rotation to aid in reducing that hip. Now back to Dr. Bond and Dr. Boley showing the technique. So we've got over, under, back to the patient, and then lift up. And you can get pretty good traction on that hip. Finally, we've got the East Baltimore lift, which is fairly similar in idea to the under-over technique, but uses at least 2 people. Cross arms with hands on shoulders, and then both of you lift from your knees up to put traction on the hip. You might need another person to help out, and be careful of injuries.
So in summary, remember that we need a lot to get the hip back into place. A lot of sedation, a lot of people. Remember, you can't do this by yourself. And also remember these alternative techniques that we've talked about, as you're a lot less likely to get hurt than in the standard method that we usually practice when reducing a hip.